This all started about 8 years ago. It was like a cough at first, and then breathlessness. I had COPD, and then it was emphysema, and now bronchiectasis as well. I didn't expect it to get the way it is, like this bad. So really that was a shock to the system, and adapting to it was hard because I was always being fit and walking everywhere. I couldn't even walk anywhere now.
About 12 months ago he had a change to his symptoms. He was getting more chest infections, he was going into A&E more.
You can't breathe, you're gasping for your breath.
And his wife would panic because she'd see he was breathless and they would dial 999.
And sometimes they just give you the oxygen and nebulizers and send you home, where other times they'd keep you in.
So that was becoming a problem over the months. The options were that David is a young, relatively young gentleman, and he wanted to regain his confidence managing his conditions, and that's where we looked at telehealth.
When the engineer brought everything, set it up, showed me what to do, it was so simple. It was just like picking up your remote control for your telly and switching over on the telly. You get a little box connected to your telly and your broadband. All you do is put your blood pressure monitor on your arm. That goes straight to the box, and then with the same with the scales, you stand on the scales. It tells you what to do.
Please stand still. Please step off the scale. 59 kilograms.
And then with the oxygen, you just put it on your finger, and everything's done there. 5 minutes or less.
When he does his observations in the morning, it then goes to what we call a hub, where there are clinical and non-clinical staff. They can see if his observations are away from the baseline that we've set originally, then it will come up as a red. If his oxygen levels are lower than normal, then a questionnaire will then be transported through the system to Dave and ask him whether he's got a cough today, whether he's producing more sputum, and whether he's more breathless. That will all be then collated there, and then I would receive a phone call.
It makes me more relaxed because I know I'm being monitored every day, where before this I was just a case of getting up, coughing, phoning the ambulance, but now I feel much better. Once you get into the routine, it's so easy. There's no technology for you to worry about. All you have to do is pick up the remote control, point it at the box, and everything's done for you. And to see exactly what your measurements are, I thought, this is great, it's brilliant.
For David himself, it's allowed him to actually review his own symptoms, to assess, even though he might be symptomatic in the morning, if he does his observations just slightly after that, he can see that actually they're okay and they're within normal levels. And even if he feels a little bit more breathless than normal, or he's coughing anything up green, then he knows that he can still phone. He knows that somebody's at the end of a line to check his observations and that they would contact myself.
There's no way you're left on your own. You can still phone your matron, and your matron comes. They also send videos through on it which explain about COPD, and there's been things on the videos that they sent through I either didn't know or I wasn't sure of, but now I realise more what it's about. Well, I was going to the hospital 5-6 times a year, but since I've had the telehealth, I've been to the hospital just once. I'd recommend anyone to get it because it does give you peace of mind. It's given me and my wife peace of mind.
Telehealth has enabled me to see a young gentleman who's quite anxious with his condition, and to see him now with more confidence and able to look towards the future because he's managing his condition much better than he was.
And more independence. Once you lose that, you've got nothing to look forward to. You vegetate, but you keep your independence, and I'm determined to keep my independence. I feel better off. I've got 2 lots of looking after, So that's looking after me, and I've got Pippa looking after me, so well, you're double safe.